Hello, I'm Kimberly Magana. I'm a first-year medical student at Oklahoma State University Center for Health Sciences in Tulsa.
And my name is Mauri Lester, and I am also a first-year student at OSU Center for Health Sciences in Tulsa in the osteopathic program. And we are going to tell you about our research over gender and geographic bias for the National Institute of Health, specifically in the study section pertaining to environmental health. Our goal was to determine if the National Institute of Health displayed any gender or geographical bias in selecting study section members for the environmental health science study section over a period of 10 years. In the past, there's been an underrepresentation of women in STEM and also an underrepresentation in certain geographical areas, mostly states. We analyzed data over a 10-year period. The years 2011, 2016, and 2021 were the years that we focused on to determine if there was a bias related to geographical location or gender for the environmental health science study section of the National Institution of Health. We did this by collecting the rosters for each of the meetings held in 2011, 2016, and 2021 for that specific study section. And in order to analyze and compare and contrast members, we looked at their name, their role within the section, and their degree, the university, or the program that they were with, where they were located, and their gender. We found out their gender either by looking at their profiles on university websites. If that was not able to be obtained in that manner, we then would utilize Genderize, which is a website that allows you to enter in a name, and if you are given a 0.6 or greater probability, then it can assign that name to a particular gender. We pilot tested with a Google form, and once our data was all obtained, we deleted any duplicates of members' names. We compared the males and the females along with the locations, the geography by region and by state.
So for our results, we showed that in 2011, 56% of the members were women and 44% of the members were men. In 2016, it was 55% women and 45% men. And then in 2021, it was 54% women and 46% men. For geography, we broke it down by region, and then we broke it down again by state. So in 2011 and in 2016, the major representation was from the South region. In 2021, it was from the Northeast. The regions with the least geographic representation were the Northeast in 2011 and the Midwest in 2016 and 2021. And then we broke it down by state. So the single state highest representation in 2011 was California. And then in 2016 and 2021 was New York. And then each of the years that we analyzed, we noticed that there were states with no representation. So in 2011, there were 18 states with no representation. In 2016, there were 22 states with no representation. And then in 2021, there were 16 states with no representation. So we can obtain from our results that the NIH has actually done a good job at selecting females to serve on the environmental health science study section, as women were actually represented more than men. However, there is room for improvement in terms of selecting members from more diverse geographical locations. And that is all we have for you. Have a good day.
Thank you.